early on, your wife, Sophie Gregoire Trudeau, got COVID on her trip overseas. Do you think that you had it? Because I know she was away, but then she was obviously in the home, self-isolating. Do you think it's possible?
Well, we know how contagious COVID is. We've got too many examples of that. It's very possible that I caught it. I don't know. I was absolutely asymptomatic, didn't have a sniffle. If I did, we followed the best medical advice, which was monitor yourself very carefully. If you even get a sniffle, we'll test you. If you don't, just stay quarantined for 2 weeks. But we just followed the rules. I think it might be interesting to wonder whether or not I had it. Doesn't make much of a difference because we followed the rules and I was asymptomatic.
You did say at one point, though, back in the spring that you would consider getting the antibody test, the serological test to see. Have you done that?
No.
Would you do it?
No, I don't think it's necessary or relevant. I mean, antibody tests, especially now that we know vaccines are coming, and it's much more interesting to figure out what the experience, what the impacts of those vaccines are going to be on immunity. That's what we're focused on.
Were you worried about the kids?
Of course, of course.
Yeah.
I mean, you're always worried about kids. We didn't know as much as we know now about who gets hit hard and how it gets hit, but we pulled together as a family. We kept an eye on each other. Sophie kept her distance, and we made it through.
Obviously, the country's really focused on vaccines. I know you're very excited about it. Everyone is. It's nice to see people getting vaccinated finally. Will you consider taking your shot publicly in order to help those who might be hesitant to get it?
Yes, absolutely. When my turn comes, I will do it publicly and enthusiastically. We've been trusting our scientists and doctors that through this pandemic, we've trusted them for years to keep us safe from measles, to keep us safe from colds, we trust our scientists, and when Health Canada says this vaccine is safe and effective to use, I am there with bells on.
When do you think you'll be in the line?
Whenever healthy adults in their 40s are open to getting vaccines, I'll be getting vaccinated.
So you are projecting right now that most of the country will be vaccinated if they choose by sort of September, end of September. Will you commit to not triggering an election until Canadians are vaccinated?
The issue is that we're in a minority parliament right now. So I don't necessarily get to choose when an election is going to come. We're certainly, as we've demonstrated, hopeful that we're going to work together with parliamentarians.
Yeah, you don't get to choose, but you could choose, because let's be honest, what you were elected on a year ago, a lot of that stuff isn't top of mind for Canadians. Is there a scenario in which you would seek a new mandate?
I think Canadians need a government that is delivering on the right plan for now. And as a minority parliament, if the opposition parties decide that we're not doing the right thing, it could be very difficult to govern whether or not they trigger an election. So we're going to stay focused on delivering for Canadians. Obviously, as we get through this pandemic and have conversations about how to build back better, how to move forward for a strong economy, we know the parties don't agree. I mean, the Conservatives have said a number of times that we've spent too much money, we helped Canadians too much, we should have helped businesses first and not Canadians. There are big disagreements about green, about all sorts of different things. As we start engaging in the recovery, we have to make sure that the government is able to do what it has. So I'm not precluding any options, but at the same time, I am not eager for an election. I think Canadians aren't eager for an election. They want to see their government there for them, and that's what we're focused on.
But if you feel your ability to govern is stymied, then you would look for an opportunity.
We're always going to work as hard as we can to support Canadians and do the right things for them, and we'll use the tools to do that, but I don't think it means an election.
Let's talk about the enormous amount of spending that you've announced.
When the virus is under control and our economy is ready for new growth, we will deploy an ambitious stimulus package to jumpstart our recovery.
$70 to $100 billion for stimulus, big programs that Liberals have been talking about for a long time, like childcare, for instance. Why is now the right time to do that? Or do you feel emboldened in some ways to start spending huge amounts of money because Canadians are maybe used to this now? They're used to seeing billions go out the door.
What we've said is that we would be there as much as needed for as long as needed while this pandemic, but that is momentary. That is contextual around this pandemic. ongoing, we're going to be extremely careful about adding regular expenses, because we know that we need to get things back into balance after this pandemic, or back on a better path after this pandemic. We came into it with the best balance sheet in the G7, and we still have the best balance sheet even with those investments.
So you want to get back to balance, or closer?
Oh, we want to get back to that path that shows growth and declining government debt ratios.
And how do you do that? Where do you create revenue?
You do that by the decision that we took early on in the pandemic, which is to make sure that once we get through it, Canadians can restart their businesses, restart their work, and not have to start over from scratch. There are places around the world that weren't able to give the kinds of support that are going to be rebuilding from zero. We are going to be able to pick up again quicker than everyone else, because we followed the advice of international monetary experts and financial experts who said, you know what, doing more to support people now will ensure a better recovery afterwards. And as the economy starts growing again, the costs of servicing the debt that we had will be lower than ever.
So we'll just grow our way out of deficit, is that?
Not necessarily. We have to be responsible in our expenses, and we always will. But to use a concrete example, childcare has been something people have long talked about. But through particularly the experience of the first wave, when kids were at home from school, a lot of businesses and a lot of economists suddenly realized, who hadn't admitted before, that childcare is an economic investment, not just a social investment, as Quebec's example shows.
Yeah, I guess that's what my point was off the top, though. You didn't promise childcare in the last election. Clearly,
actually, I did.
You didn't promise a national childcare
No,
program.
we talked about continuing our massive investments in childcare and moving towards greater childcare.
Yeah, but my point is, are you now taking on these projects because you feel comfortable spending this kind of money?
No, I'm taking on these projects because they're the right things for Canadians. As people have understood that childcare is, as I said, an economic initiative, not just a social initiative, there is a demand from the business community as well that we move forward on childcare.
You've watched the second wave hit some parts of the country much harder than the first. I'm thinking of the prairies, Alberta. Do you consider that a failure of leadership or of personal responsibility?
It's not my job to judge what the provinces are doing. It's my job to be there for them. With the supports we gave to businesses, to individuals, with the supports we sent to the provinces, whether it's PPE, rapid testings, or now vaccines that we're paying for, our job as a federal government is to support them in the tough decisions they need to make.
You've talked about the rapid tests a couple times, and there are provinces that they're just sitting there, they haven't used them. There are some provinces didn't take the help for contact tracers, some provinces still not using the COVID alert app. Should you have been more forceful in telling them to take this support? Because it must be frustrating to offer things and not see them use it.
We had 22, 23 different First Ministers meetings over the course of this pandemic, almost every second week for a long stretch. We were there to give them the support, but every step of the way I said, look, I understand that the situation in Nova Scotia is different than the situation in Saskatchewan, different from the situation in Yukon. We're giving you all this help. Tell us what you need. We'll be there to help you. You do what you feel is right for your province, and that's been our focus.
At various points over the past year, there have been suggestions you should have done more. The Emergencies Act, setting some sort of national standards for restrictions. Do you think that the division of powers in this country has served us well? And by that, do I mean, do you think that COVID has strengthened or weakened the Federation? Because it has been complicated.
I think there's, whatever situation you look at, you can say, oh, it's better because we're a federation because it gives more flexibility, or it would have been nice to have been a unitary state because you could just declare things and have things happen. Whatever crisis you go through, there are arguments on both sides. I don't spend a lot of time thinking about it. Canada is Canada. We're what we are. We work with what we have, and the work between the federal government and the provinces has been extremely strong. We've worked together to keep Canadians safe.
But you don't think at any point, or was there a point, I guess, where you thought, I'm going to have to show a little bit more leadership? I'm going to have to be a little more forceful with the provinces?
There were a couple of things, like a collection of data, for example. Everyone has their own healthcare system, and they manage it very, very well across the provinces in general, but there is not a lot of data sharing. And even when the data is shared, often it's collected slightly differently in different places, so it's hard to collate. That was one of the early challenges where we said, okay, you know what? I know you guys all have jurisdiction over your healthcare, but can we start aligning our data better so we can have a better picture of what's happening across the country? And they were like, okay, yeah, we haven't really done that, but we should figure it out. And we figured it out. We've gotten a lot better. It would have been easier had we had all one system now, but we don't. So let's figure out how to make the system we have work.